Okay, this video is called The Medical Patient. I talk to a lot of internal medicine doctors, a lot of neurologists, and this is a typical patient. And just want to give you the types of things that they say to me. Okay, so the internist says to me, he says, even when the drugs work, these patients don't do so well. I said, what do you mean? He says, I got a 61-year-old guy, same age as me, whose labs are improving, but he's getting sicker. He's on an ACE inhibitor and a beta blocker for his hypertension. His pressure's okay, about 130/90. We put him on Ozempic. He lost 25 pounds. His diabetes meds, his hemoglobin A1Cs came down nice, from 8 down to about 5.5, His kidney function's okay, holding in there. GFR about 65, I'd like to keep that above 60. But he's got AFib, and, we've got him on amiodarone for that. He had high cholesterol, so we put him on a statin, and cardioprotective aspirin for that. His total cholesterol's come down. It's improving. It's about 150. Well, that sounds pretty good for the typical polypharmacy medical patient. Internist, but he's not doing well. He's getting recurrent episodes of cardiac angina with chest pain, shortness of breath. He bumped his troponins, had a small, myocardial infarction, heart attack. He's probably going to end up getting a stent or a cabbage. Euboxemia ain't a cure. Okay, so what euboxemia means, U means true or normal. Boxemia means you fill in all these little boxes, like on your Chem 7 when you write out the patient's labs and stuff. And the point of that is that you can make the patient's numbers look good, but if the underlying problem is they're still eating high-fat diets, they're still plugging up their arteries, and nothing works well when its arteries are plugged up. Okay, internist, he eats a high-fat, high-sodium diet, so he's still got insulin resistance, probably all that blood spludge, tissue hypoxia stuff, leaky gut stuff, and then, the electrolytes are screwed up. He's going to have high, because he's eating all the sodium and he's not eating the plant food, he's going to have high cytoplasm calcium, low potassium and magnesium. Drugs, they slow things down a little bit. Patients do a little bit better with the drugs, but you can't cure a dietary disease with pills. The patient, does a little bit better with the pills, but they still tend to have lousy outcomes. Internist, the vegan diet's the only thing that works, but nobody wants to do it. I tell them to read Esselstyn and McDougall, but they don't do it. I'm so busy, I don't have time to explain all the details. I said, well, at least you gave him a chance. It's not your fault. You can't push somebody up a ladder.